Welcome to all those watching this video. This video is about formation of a dilute urine. A person needs to excrete a dilute urine which has osmolarity less than that of plasma, less than 300 milliosmoles per liter, when he drinks a large amount of water, when he or she drinks a large amount of water. And this drinking of large amount of water occurs when the person exerts himself or herself as after a sporting duel or in a hot environment or after a party. First, we need to understand the characteristics of each part of the nephron regarding reabsorption of solutes and water before we understand how a dilute urine is formed. There is a proximal tubule, the descending thin limb. The proximal tubule continues as a descending thin limb which curves, forms the thin ascending limb and then the thick ascending limb. Each of these has different characteristics regarding reabsorption of solutes and water. Then there is the early distal tubule. The early distal tubule is more or less similar to the thick ascending limb, and it forms it continues as a late distal tubule which forms a functional unit with the collecting duct. The late distal tubule and the collecting duct form a functional unit. When a person drinks a large amount of water, dilute urine with an osmolarity of less than 300 milliosmoles per liter is formed. Normally, the urine osmolarity varies from 50 to 1200 milliosmoles per liter. Under all circumstances, the proximal tubule reabsorbs equal amounts of solutes and water. So, urine at the end of the proximal tubule is isoosmotic. The descending thin limb is freely permeable to water. It has aquaporin 1 on both the apical and basolateral surfaces. Hence, urine at the end of the descending thin limb is hyperosmotic. It has osmolarity greater than that of plasma. The thick ascending limb is freely permeable to solutes, but it is impermeable to water. Contrast this with the descending thin limb, which is freely permeable to water. So, urine at the end of the thick ascending limb is hypoosmotic. It has osmolarity slightly less than that of plasma. It is also known as diluting segment. The early distal tubule is similar to the thick ascending limb, meaning thereby that it is impermeable to water but freely permeable to solutes, and urine osmolarity at the end of the early distal tubule is always, please remember this word, always 100 milliosmoles per liter. So this is known as the cortical diluting segment, and it is a site of powerful diuretics called thiazide diuretics. The late distal tubule and the collecting duct is the final judge, and its permeability to water is dependent on ADH. In the absence of ADH, little water is reabsorbed. A large amount of dilute urine is excreted. There is absence of ADH because the osmometers in the anterior hypothalamus detect the low osmolarity, do not secrete ADH. Little ADH is secreted, little water is reabsorbed, and a large amount of dilute urine is excreted. Thank you for watching my video. Have a good day and please subscribe to my channel.